As the technical lead for the global mpox response, you have been at the forefront of an evolving outbreak. How did the global health community's response to mpox differ from traditional outbreak responses?
So this has been a fascinating experience and a fascinating outbreak to be a part of and to lead in some respects, in many respects. So the first part of the global outbreak in 22-23 was really all about learning how to work with affected communities, learn the language that is preferred by them, and to work directly with them. So that all of our messaging that we developed, even at the global level, was done with our community reference group, Men Who Have Sex with Men, for example, because the modes of transmission were completely new for this particular disease. Sexual transmission had not previously been recognized for mpox.
Hello and welcome to 72 Dragons Health. Let me introduce you to Dr. Rosamund Lewis, the technical lead for the World Health Organization's response to monkeypox. Dr. Rosamund Lewis heads the World Health Organization's Smallpox Secretariat within the Health Emergency Program. She holds a Bachelor of Science and a Doctor of Medicine degree from McGill University, as well as a master's degrees in epidemiology, biostatistics, and management. She's also a fellow in family medicine, public health, and preventive medicine. Her career spans multiple organizations and sectors, including the World Health Organization, the Government of Canada, Doctors Without Borders, the Global Alliance for Vaccines and Immunizations, GAVI, and the Canadian International Development Agency, now a part of the Global Affairs Canada. Dr. Lewis has worked in emergency preparedness, disease surveillance, immunization, and risk communication, and has published extensively in these areas. In addition, she has been a prominent public health voice in global health, particularly during the 2022-2023 mpox outbreak. She combines medical expertise, epidemiological insight, and strong public communication skill to lead global responses to infectious disease threats. Welcome to this interview, Dr. Rosamund Lewis. It is an honor and a pleasure to have you with us today.
Thank you very much, Dr. Aparicio. It's a pleasure to be with you.
Dr. Lewis, you have been associated with multiple organizations, including the World Health Organization, the Government of Canada, Doctors Without Borders, and the Global Alliance for Vaccines and Immunization, GAVI. What have been the highlights of your experience with these organizations that have significantly shaped your career?
Thanks very much. It's certainly been a privilege to work with organizations that have different mandates and different ways of working. And so by having that opportunity, I have learned that really there's a place for everyone, every individual and every organization, because different organizations have different roles. And so, of course, I started as a family doctor. That is very much what I wanted to do. And in emergency medicine, for example. But then I also wanted to join field work and do what I could for people who are far less privileged than we are in Canada, where I grew up. So Médecins Sans Frontières, or Doctors Without Borders, was a place to really see firsthand how other people live and how they experience their health. It can be dramatic. Of course, we're seeing it even today, but already decades ago, refugee camp situations, displaced persons, conflict. And so with MSF, you really get to see how to be close to the people and how to work directly with communities and affected populations. And then as I grew in my career, of course, I worked with the Government of Canada in development, later again with the Government of Canada at the Public Health Agency and with the World Health Organization. And at each stage, you're shaped by the world events around you, but in each environment, I really see what it is that I can do that can make a difference, whether it be at the local community level for an individual patient or whether it's at the global level, and trying to leverage the public health skills that I've learned. And so it's really been a privilege to be part of all of that ecosystem and to identify how to advance public health for individuals and for communities.
Great. Thank you for sharing your journey into public health. As the technical lead for the global mpox response, you have been at the forefront of an evolving outbreak. How did the global health community's response to mpox differ from traditional outbreak responses? And what specific innovation or strategies were most impactful in controlling its spread?
So this has been a fascinating experience and a fascinating outbreak to be a part of and to lead in some respects, in many respects, because it has been very different from many others. It very quickly became this fascinating mix of what is a zoonotic disease. So originally a virus transferred from animals to human communities and populations, which found new ways of transmitting. And so suddenly we were faced with a sexually transmissible infection on the global stage. And so the first part of the global outbreak in 22-23 was really all about learning how to work with affected communities, learn the language that is preferred by them, and to work directly with them. So that all of our messaging that we developed, even at the global level, was done with our community reference group, Men Who Have Sex with Men, for example, because the modes of transmission were completely new for this particular disease. Sexual transmission had not previously been recognized for mpox. Now we're still dealing with community transmission in Africa, new clades emerging, still some communities at higher risk than others, also children and pregnant women. It's very complex. And so the messaging is critical because it has to be adapted to each context. The disease evolves differently in different populations and different contexts, and therefore the messaging for communities to feel that they can make the decisions to protect their own health has to be adapted to each context. So that's been a major learning of the response. Well, the second is basic public health, surveillance. You have to really have surveillance, and you have to adapt that surveillance constantly to understand modes of transmission. Therefore, you can intervene from a public health perspective. Once you have that, you can also then offer other countermeasures such as vaccines, which are now becoming available for Africa and have been for the last year or so. And so we are now able to offer support for community engagement and risk communication, as well as support for surveillance, clinical care, and vaccines and other areas of work. So it hasn't been different because of that necessity to develop stigma-free messaging. Stigma prevents people from approaching health services and getting care. And therefore, being able to offer neutral, patient-friendly, stigma-free services becomes critical also in every context.
Thank you. You mentioned vaccine. In your view, what are the most pressing equity issues related to vaccine access to mpox, and how can global actors such as the World Health Organization help ensure fair distribution?
Right. So what we're doing right now for access to vaccines is that we have what's called an access and allocation mechanism at WHO for countermeasures for mpox. And this is being used for diagnostic tests as well as vaccines. And it's critical because right now we are relying on donations from wealthier countries that have stockpiled vaccines, either for smallpox or mpox or both, and are now providing donations that are being made available to low-income settings. So that is a complex exercise, and it's important to try and understand where the epidemiology is going in any given context, who might be at risk, and how many vaccines might be needed, because it remains a very constrained environment. In that environment, we can find other strategies such as dose-sparing strategies. One of the vaccines we're using is a 2-dose vaccine, but you can get more impact by vaccinating more people with a single dose than offering the same people 2 doses in a supply-constrained environment. So countries are now moving to a single-dose strategy for now, because more people can be reached. Again, you might have heard in mpox also even one vaccine dose administered subcutaneously could be given intradermally, and you can get 4 doses out of a single dose. So you can multiply the number of people you can reach by 4 to 5 times by changing the mode of administration, which also requires additional training, awareness, understanding by the community what's being changed and why. So there are a number of different strategies that can be brought to bear to increase access. But at the end of the day, funding remains critical, because funding to procure vaccines for a global emergency response reserve is what we're working on now. So that as we come out of the acute phase, global outbreak, but also the major outbreak in Africa of clade 1b mpox, we need to construct a mechanism that will be sustainable in the medium to long term, which is to have an emergency reserve that can be deployed when an outbreak manifests somewhere. So there's a lot that is being done, needs to be planned for the coming months. I think one of the things that we learn in outbreak response is that when it's no longer in the media, then everyone thinks the outbreak's gone. But the reality is most of the time that's not the case. So for some diseases, such as viral hemorrhagic fevers or Ebola, for example, the outbreak response will pursue the effort right down to the very last case. You have to maintain an effort, continue to inform the public that there are still risks for some people in some contexts, for more people in other contexts, and we have to keep working.
It sounds like a lot has been done, but there's still a lot of challenges. Now, as we were preparing for this interview, we found a lot of information about mpox on the internet and social media and other digital media information. So in today's era of misinformation and digital media, how do you navigate the challenge of delivering accurate science-based communication in a way that resonates with diverse communities around the globe?
So there are two aspects to this, and one of them I've mentioned already, which is risk communication. So basically, boiling down the messages to the bare bones, the simple key messages that will help people identify, am I at risk, am I not at risk? Acknowledging what we know and what we don't know, and sharing that with individuals and communities and saying, here's what we know about who is at risk. If you identify with that, then these are the steps that you can take to reduce your own risk, mitigate the impact on your own health, and protect your community. And people need to have that information, make their own decisions to protect themselves. The second part is what you're alluding to, which was basically what we call now infodemic management. So managing the overwhelming quantity of information that is shared online that is often not correct or not entirely correct. It has a kernel of truth, which allows it to be believable, but then misinformation is layered on it. Or disinformation is where people intentionally try to mislead others. And so there is a new discipline that has emerged out of COVID-19 response, which we have also used in mpox outbreak management, which is infodemic management. So monitoring the social media space, identifying what the messages are that are circulating, boosting the ones that are correct maybe, but also offering alternative versions of information, of correct information for messages that are incorrect. So WHO does have a service that manages the infodemic, if you will. It's less in mpox than it has been in COVID. And in mpox, we've worked really hard to communicate the clear, correct information right from the beginning. Even as we didn't know everything, and we still don't know everything, we try to communicate what we do know. And so there's been less of a problem, but there's still been a lot of stigma related to mpox. Certain communities, our countries, even reluctant to report cases, for example. And that makes it challenging. If we don't know where the virus is moving, who it's affecting, it can certainly delay our ability to stop an outbreak. So having correct information, for the right people at the right time is a critical part of any outbreak response.
Thank you for sharing about the infodemics. Now, the recent 78th World Health Assembly, what are the key priorities countries should focus on to enhance their resilience against future zoonotic diseases outbreaks?
So there's a number of elements in that question. One is the recent Health Assembly, which is held at WHO every year. For those of your audience who don't know, the Health Assembly is the governing body of the World Health Organization. It is composed of the ministers of health of all the member states. So these ministries of health come together once a year and look at the global public health agenda. So new resolutions can be proposed. So the message coming out of the World Health Assembly this year has been, public health remains absolutely critical for global health security. We can't only work on military defense if we don't also have health security for the population. So we continue to work all our various program areas, and zoonotic diseases come under the One Health umbrella. One Health is where we look at human health, animal health, and the environment all at the same time, because we've talked about defense and public health, but the environment, climate change are also very challenging areas, the context in which we work right now and areas in which we need to work. So we do, for zoonotic diseases, work with intersectorally, collaboratively with environmentalists as well as animal health specialists and public health, because it's at the intersection of those three things that we see new viruses emerging, or viruses that have been dormant or quiescent emerge into a more vulnerable population, or because the climate is more suitable for them, they can move into new geographies. So we're seeing all of these things happening. And so basically emerging infectious diseases remain, amongst all the other challenges the world faces, a top priority for WHO. So it never gets boring, I can assure you about that. It's fascinating to work in public health. For those who haven't already experienced it, you'd all be very welcome.
Thank you. It's really fascinating. And thank you for sharing the One Health approach. Dr. Rosamund Lewis, thank you for your outstanding contributions to global public health, particularly your leadership in managing the World Health Organization's response to mpox and advancing strategies for infectious disease preparedness. We look forward to the continued influence of your work on public health systems at both national and global levels. Thank you.
Thank you very much.